Thank you, and I'm honored to be speaking in front of you today. My name is Dr. Villavicencio. I'm an OBGYN resident at Brown University. I'm currently in training, and I'm also an abortion provider. I come to you with humility and respect, representing the governing body to all OBGYNs, the American Congress of Obstetricians and Gynecologists, also known as ACOG. I also come to you representing myself, an abortion provider, and those women to whom I dedicate 80 hours a week, every week of my life to. These women are your mothers, are your daughters, are your sisters, are your friends. Look around you. 1 in 3 women by the age of 45 will have undergone an abortion. I ask that you oppose both bills H7611 and H7282. I'll be testifying separately on both of them. The first one that I'll speak about is 7282 regarding the D&E procedure. Dismemberment is not a medical term. It's not something that we ever use, and I will refer to it only by the medical term, which is dilation and evacuation. This bill is pure legislative interference. It all but abolishes the use of safe, necessary, and scientifically sound procedure. It transports choice, discussion, and important decision-making from the physician-patient relationship into this state house, a place that I think that everybody in this room agrees a medical decision should never be made. This bill targets specifically the physicians who practice and care for my patients, your constituents. Dilation and evacuation, or so-called dismemberment abortion, is the preferred method of second trimester abortion because it results in the fewest complications for those women seeking second trimester abortions. I was able to take a look at the written testimony that was submitted to you by my counterpart, and I'm happy to answer any questions but take issue with quite a few of the statistics and the facts in there. I consider myself an expert on this procedure. I have performed it many, many times, and I take issue with that handout. Passing this bill, given that this makes illegal the procedure that has the fewest complications in an already legal and safe procedure, would lead to increased complications and worse outcomes for your constituents. This is unacceptable. Medical care must be guided by sound science and by each patient's individual needs, not by legislative restrictions. We, ACOG, continue to oppose laws that limit the ability of Rhode Island women to get the reproductive health services that they need and that take medical decisions out of the hands of physicians and their patients. In regards to 7611, which would make partial birth abortion also not a medical term, a felony, I ask that you oppose this bill with the same vehemence that I do. It presumes that the legislature knows what is better medically for women than their doctor. It is also scientifically unsound, and it's an assault on physicians. Given that I represent ACOG, I have to tell you, I am insulted. The authors of this bill presume that the legislature is more confident than the cumulative centuries of medical education that exists in this state. This expertise has time and again reiterated that abortion is one of the safest procedures a woman can undergo. A DNX, dilation and extraction, or so-called partial birth abortion, constitutes less than 1% of abortions performed in the United States. I have been training in abortion for several years and have never seen this procedure. Regardless, it is safe. It furthermore seeks to penalize the men and women taking care of your constituents with one of the stiffest criminal charges, a felony. As a resident of Rhode Island, as a woman, and as a physician, I hope that you will do the right thing by opposing this bill. I hope this because I know that you would want your doctor to make decisions about your health and the health of your family based on the best medical science available, based on in-depth, personal, and private conversations, and not the ill-advised policies of an out-of-touch legislature. You deserve better, and your constituents deserve better. Thank you.
Thank you. Any questions for the doctor? Vice Chair Costa.
Thank you, Chairman. I just have one question. You're talking about second-term abortions. How
Yes,
old
ma'am.
is the baby because it's been a long time since I've had a child. So how old is the baby when the second term starts?
So the second term starts at approximately 12 to 14 weeks.
And how long is it that you can actually perform the abortion?
In the state of Rhode Island, up to viability, which is 23 weeks and 6 days.
And is the baby fully formed at that time?
The fetus has anatomical features, yes.
What does that mean?
That means that the fetus has all of, I guess I don't understand your question, what fully formed means.
So at 23 weeks, you're pretty much looking at a baby, a fully formed baby?
A fully formed fetus, yes, but its brain is not completely developed, its heart is not completely developed, its intestines are certainly not completely developed.
Thank you, doctor.